Imagine the world 2,600 years ago. If you suffered a severe physical injury or contracted an internal disease in the 6th century BCE, your fate was practically sealed. It was a guaranteed death sentence. Punishments of the era were brutal, often involving the severing of noses for certain crimes, and common afflictions like cataracts meant a slow, irreversible slide into total blindness. Yet, while the rest of the globe struggled with crude remedies, one specific region harbored an incredible anomaly. A pioneer was already performing complex, successful reconstructive surgeries. At a time when treating the human body was considered taboo and healing was largely based on superstition and guesswork, there was absolutely no systematic medical science. That is, until one individual stepped out of the dark. That individual lived here, in the ancient Indian city of Kashi. Long before the modern era, it was an emerging epicenter of scientific thought. This was the home of Acharya Sushruta. He operated differently from the traditional physicians of his era. Instead of relying solely on traditional herbs, Sushruta approached the human body as a rigorous empirical scientist. He held a highly controversial belief for his time. Reading medical texts was entirely useless, unless a surgeon possessed a precise, hands-on understanding of human anatomy. Sushruta's objective was the creation of a reproducible, disciplined science of surgery, moving far beyond the scope of a single physician treating a single patient. Early surgery faced a massive bottleneck. A surgeon cannot practice making incisions on a living patient without causing excruciating pain or worse, death. Sushruta solved this by developing the world's very first surgical simulation training program. Students practiced incisions on gourds and pumpkins, rehearsing the precise angle and depth, and performed delicate needlework on lotus stems. This was backed by detailed study, meticulously mapping over 300 distinct bones and muscles. By forcing students to master simulations before ever touching a live human, Sushruta eliminated fatal guesswork. He turned surgical success into a reproducible, scientific outcome. But perfect anatomical knowledge is useless without perfectly engineered tools to actually execute the cuts. To meet this need, Sushruta conceptualized, designed, and categorized an enormous arsenal of over 120 distinct surgical instruments. You can see the identical shapes shared between his original designs and modern operating tools. He forged scalpels, surgical scissors, specialized needles, and forceps. He employed a brilliant biomimicry design philosophy. Sushruta shaped the grips and jaws of his instruments based on the mouths of specific animals and birds, achieving optimal clamping force. These 2,600-year-old designs are so ergonomically perfect, surgeons today rely on the exact same fundamental shapes. This 120-piece toolkit defined surgery as an exact, micro-level engineering discipline, replacing the haphazard methods of the past with standardized instruments. The ultimate test of his tools and simulation training came in reconstructive plastic surgery, specifically for patients who had their noses severed as punishment or in battle. Sushruta developed a revolutionary rhinoplastic concept. Rather than reattaching dead tissue, he harvested a skin flap from the forehead to reconstruct a living nose. By leaving the base attached, he maintained continuous blood supply, ensuring the new tissue heals. He applied this same microscopic precision to the human eye, developing a specialized technique using a curved needle to carefully push blinding cataracts out of the patient's field of vision. Successfully executing highly vascular, delicate operations of this magnitude without modern anesthesia or antibiotics proves an unparalleled mastery of human biology. Sushruta recognized that an individual's genius dies with them. To prevent his methods from being lost, he meticulously documented his entire scientific framework into a massive text called the Sushruta Samhita. The sheer volume of data in this encyclopedia is staggering, containing detailed instructions for over 300 distinct surgical procedures. The text established a complete life cycle of patient care. It documented the mechanics of the incision while simultaneously mandating strict preoperative and postoperative protocols. Surgeons were required to thoroughly examine the patient's overall physical health before ever making an incision, and they had to follow rigorous sanitation regimens to prevent infection long after surgery was over. Inventing a unified standard of care timeline is the defining leap that separates a lone, skilled medical practitioner from a permanent scientific institution. Over the centuries, the Sushruta Samhita migrated, translating into Arabic and disseminating among European scholars. There is a direct line to modern medicine. European physicians explicitly studied his 2,600-year-old skin flap techniques, laying the foundation for Western plastic surgery. The 120 tools, the simulation training, and the 300 complex procedures we view as modern marvels were completely mapped out thousands of years ago in ancient Kashi. His lasting impact is found in the rigorous scientific mindset he seeded into human history. By codifying these exact, disciplined methods into a reproducible system, Acharya Sushruta established the modern scientific approach to surgery, cementing his status as the father of surgery for all of humanity.